Hey guys, welcome back to my channel. In today's video, I wanted to go over a few things because I get this question quite frequently. I get the question, what's the difference between nursing as becoming a registered nurse or a registered sonographer? And there are quite a few differences. So I thought I'd make a video to go over this. And also, I got the question and I thought it was really cute. If I could go back, would I become a nurse? Absolutely not. I think nurses are amazing and they do a lot of stuff that I'm not willing to do. So with that being said, let's go ahead and hop on into this video. Okay, so first things first, nurses and sonographers work directly with patient care. So we need to know how to speak to patients. We need to know how to investigate, find out what's going on with that patient in order to get them into a healthier, better feeling place. So with that being said, both professions are completely different in multiple ways. And I say completely different in the sense that obviously with ultrasound, you're working with medical imaging. Nursing, you're working a more broad spectrum, in my opinion. So correct me if I'm wrong. By all means, if you're a nurse and you're watching this video and I say something that may not be correct, or if you want to elaborate on it, please leave us a comment down in the comment section below so that way we can learn something from you. But I'm trying my best here. So I'm gonna start off with the sonographer part because that's what I know, and then I'll go into what I think the differences are in nursing. So as a sonographer, our duties kind of depend on what area we're in, whether we are pediatric, OB, MFM, general vascular, echo. Our duties will vary. Again, like I've mentioned in the past, like if you work in a clinic versus a hospital, your duties will also vary as well. So the biggest thing that I would say is as a sonographer, you have to talk with the patient to kind of get a better understanding of their symptoms to help with your investigation. So that's a big thing there. You have to have very good patient skills and so on and so forth. So as a sonographer, you also will be taking images, or not images. You'll also be taking patient history, because when you're doing the patient history, you're reading through the patient's chart, you're getting kind of an idea what you should be looking for. So if a patient's complaining of, I like to use this one quite frequently because it's the most common that I've seen, but if you have a patient complaining of right upper quadrant pain or epigastric pain, you know at that point that you're gonna look you're gonna look mostly in the liver or pancreatic area. You're gonna check the for gallstones or tumors of the pancreas, or pancreatitis, that's inflammation of the pancreas. So you're definitely gonna take patient's history and you're gonna be talking to them. So like for instance, if they have a gallstone, and it's a pretty large gallstone, and you're scanning over that area, if they say there's tenderness there or if it hurts there, then you know more than likely they have a gallstone. So you're gonna be looking for gallstones or an obstruction of the common bile duct. So that's the biggest part, in my opinion, as far as being a sonographer, when is taking history of that patient, so you know it can help you with what you're looking for. Also too, we need to know our machines like the back of our hand. Yes, every machine is a little bit different and your annotations are going to be different, but you need to know how to work a machine. Honestly, I've heard so many people say, I can't do that because I'm not good on that machine. Well, I'm sorry, you're a sonographer. You need to know your knobology for any machine that's out there. If you get a new machine and let's say it's a Philips versus a Samsung, you need to go and figure out that machine prior to seeing your patient. Just take a peek. Most of the time your buttons are going to be the exact same. They just might be in a different area. So in my opinion, a sonographer needs to know all machines. So definitely just take a look before seeing a patient so you don't look like you're lost, like it's your first day on the job. Also, you need to know how to position your patients. For instance, you need to know, like in my field as a MFM sonographer, when a patient is in her 3rd trimester and she's laying on her back and she starts to tell you she feels lightheaded or nauseous, you want to know that you have to turn that patient on her left side till she feels better. You need to help her. Also, if you're working in the hospital and you're doing a venous scan, you need to know how to place that patient in order to get better flow in those legs, or how to roll that patient's leg out in order to get what you need without hurting the patient or causing the patient any more pain. We definitely need to work on our ergonomics as well. You need to know how you can move patients effectively without hurting yourself, or how you can scan patients without hurting yourself, because yes, after years and years and years of scanning, you are prone to work injuries. So, and I also thought that would be a good video later on, that maybe I could do like an ergonomics video, but it kind of sounds boring. So maybe I would do stretches to show you how to prevent injury, or when you have a sore muscle, what you can do to feel better. I don't know, just an idea. But anyhow, like I was saying, as a sonographer, when you are able to produce images, you want to know how to make those images look better on screen in order for you to see any pathology that may be there, so that it stands out more. I highly suggest for student sonographers going through school to scan every chance that you get. Scan, because the more normal tissue that you see, the more easy pathological tissue will stand out to you, because you're gonna be, oh, that doesn't look right. Let me investigate a little further. Let me zoom in. Let me change this setting to make this stand out more, so that way I can prove my point to the radiologist when I send these pictures over to them. So if you're a student or you're new to sonography, scan as much as you can. Don't be scared. And at the end of the day, if you find something that you think is questionable, before sending over to the radiologist, ask a fellow sonographer. We are always willing to help you if you're willing to come ask for help. Same thing for radiologists. Some radiologists are different, but for the most part, what I've experienced are radiologists, if you call them, hey, I just saw this patient, I think this is something, but I'm not quite sure. They're willing to look at it with you and go over it with you, and then at the same time, you're learning something. So definitely don't be scared to ask for help. As a sonographer, our jobs are very important. And like I said, we work hand in hand with the nurses. We also work with the radiologists, and the radiologists are depending on us to know how to do our job in order to produce images, so that way they can make a diagnostic opinion on this patient, and that way the nurses and the other doctors can figure out how to treat this patient further on. So with that being said, I think a sonographer's job is very important, and we're very useful, and the job career field is continuously growing, especially as technology advances. So I personally love what I do, and I don't know if I answered this earlier, but I had a comment earlier today asking me if I could go back and do it all again, if I'd want to be a nurse or a sonographer, and I don't even think that nursing would be in my thought process, okay. I guess. Now, for a registered nurse, and again, please correct me if I'm wrong, but there are different areas of expertise in the registered nursing field. For instance, you have your operating nurses who work in the OR. You have pediatric, NICU, labor and delivery, trauma, everything. I mean, there is a nurse specialty for anything. It's just the same as sonography. We have our specialties, they have their specialties. But from my understanding, nurses, the biggest difference, and I'm gonna say this because this is for me, the biggest difference is sonographers, the closest we come to working with needles is setting up our tray for procedures. That's it. Nurses draw blood, give blood, administer medicines, set PICC lines. They do all that. I don't like needles. I couldn't do it. So thank you to all the nurses out there, because you are very, very much appreciated and very much needed. But that's, to me, the biggest difference between ultrasound and sonography. Now, when it comes to nurses, they are taking vitals for patients. They are, like I said, administering medications. They are talking with the doctors to find out what medications need to be ordered. I've got a list here that I'm reading on because I don't want to forget anything. I definitely don't want to make their job sound any easier, because honestly, in my opinion, a nurse's job is a little bit harder than mine. And some people may disagree with me. I guess it's all in perspective. So I just don't want to miss anything. But yeah, nurses will also monitor a patient's diet. If they have certain restrictions that they can't have, or something that will make their condition worse, they're gonna monitor that. So they're needing to know a whole lot of things. Nurses also have to deal with patient care and how to handle patients, how to transport patients. There's so much that needs to be learned, like helping change a patient that can't change themselves, bathe the patient. Those nurses also have to be able to communicate pretty well with patients' families and the patient and the doctor, so they know how to manage a healthier lifestyle, or how to handle diseases, or what to expect. So nurses' jobs are super, super important. And I also, on top of that, I get the question quite a bit, do sonographers and nurses get along? I do think that I personally have never experienced the negativity in that aspect, but I've heard so many stories, and what I would have to think is that nurses don't, because of their broad spectrum of things that they have to do, they don't understand how hard our job is. And so a lot of people feel like ultrasound is just taking pictures, and that's fine if that's what you believe. But what we do, we have to know a lot. We have to know disease processes. We have to know what certain diseases look like. We have to know anomalies and disorders. We have a lot of stuff that we have to know. And so I think the problem there is that a lot of the nurses don't quite understand what goes in to doing an ultrasound and getting effective pictures. So I kind of feel like maybe they think that our job isn't as important. But if you ask any good nurse who's been in the field for a long time, who's worked with ultrasound techs and sonographers, they will tell you that how important our job actually is. And in my experience, I'm willing to work with a nurse that's gonna come talk to me, hey, can you do the ultrasound bedside, because we still have to do this. I am all about helping one another out, because this isn't, at this point, it isn't about me or them. It's about the patient and how we can efficiently help this patient get to feeling better, or and also efficiently do our job. So I personally don't see any like negativity between nurses and sonographers. If we work together, we ultimately get the job finished and move forward. Now, I will tell you this, in the clinic side, we are like a big family. We work hand in hand with the MAs and the nurses and the doctors, and I don't see anybody not getting along with one another. So We actually talk to them. Hey, this patient, what did she say here? Or, you know, whatever the case may be, we talk. And I don't see any kind of negativity between nurses and sonographers. So, anyhow, to conclude this video, those are the differences in my opinion. I am a little biased because I don't want to be a nurse. Not that there's anything wrong with nursing. I just personally know that they do certain things that I'm not willing to do, like draw blood. I just don't want to do it. I've done it before, don't want to do it. Probably not a good idea to let me draw a patient's blood because it scares the shit out of me. So, and maybe I shouldn't have cussed, but it's okay. We'll bleep it out. But anyways, that's what I see as the differences between nursing and sonography. So like I said, if you have any comments or have any questions, leave us a comment down below. And if you're new to this channel, please subscribe because I'm going to have a lot more videos coming up. I have a lot more planned and I'm really excited about everything that's to come. So I hope you enjoyed this video and I hope you have a wonderful day. Thanks guys.